We're in a very rural community here in the San Luis Valley in southern Colorado. We're one of the poorest counties, not only in Colorado but in the nation.
We see a lot of Medicaid patients. We also see a lot of patients that have diagnoses such as diabetes, hypertension, really patients that are requiring quite a bit of care.
We still want our patients to feel like this is their small town doctor. This is where they can come to get the help they need. That's what we want to create, and our Patient and Family Advisory Council will help us create that.
We now have 28 practices in 4 counties here in the capital region of New York State. We have practices that are in rural areas, suburban areas, locally urban areas, and we have some very large, relatively speaking, large practices within the group with 7 or 8 providers. And then we have some practices that are solo physician practices.
At Capital Care Medical Group, there's 10 Patient Family Advisory Councils. We really feel that each site should really operate in the way that they feel most authentic and comfortable. As a central business office, we absolutely will help facilitate the meetings in any way that we can, and we've helped provide a support structure to help our sites be successful.
How do you improve quality? There are a couple of ways to do that. One is to do patient surveys, but the other way is to do it from a Patient and Family Advisory Council format. You actually have a group of patients that give input, partner with you to making quality improvement changes.
Surveys lend themselves to providing feedback on what is currently in place and the care that we're currently delivering, but we really wanted to focus on how patients can be part of determining what should be implemented.
When you create a patient advisory council where they are true partners in the decisions you're making, it changes the whole dynamic.
Our patients see things a little bit differently than we have seen them in the past, and so it really provides a lot of opportunity for growth and enhancement of our services and how our patients receive those services.
Being able to have patient voice is a positive step towards medical professionals understanding maybe some of the needs you don't always consider.
I think it's made me more aware of looking at each patient care experience from the patient's perspective.
When I first went to my meeting, you didn't know what to expect. Since our meetings last year, they've grown. People are now expressing their voices, their concerns, their issues. And you can tell when you're going back to your doctor for your medical needs, you can see the improvement being made.
From the first meeting, what we were saying was valued. The people involved are the right chemistry.
We're all too busy to just sit on another committee that really doesn't have any end results. They are very good at respecting our opinion and really feel like they value what we have to say and our suggestions.
It's kind of reassuring to know that they take our point of view into consideration when they're contemplating a procedure change or moving forward with some of their outreach programs.
A lot of what our PFAC committee has done has spearheaded a lot of the initiatives that Capital Care has taken on as a corporation-wide initiative.
It really has shaped, I think, the way our office is providing care to patients in general.
There have been a lot of assumptions that have taken place prior to these council meetings. If in our internal medicine sites we have elderly patients, then we shouldn't message as much through the internet or technology. That is in fact incorrect. We have a large percentage of our elderly population who are very computer savvy.
One of the issues that our patients had was they asked for a prescription refill on our patient portal. They were very concerned because they weren't aware that anyone received the message. Well, the message was being received, but one of the workflow issues that needed to be addressed is just a simple reply: we received this and we've called this into your pharmacy.
Some of the patients were having problems getting messages through to their physician, not knowing if the message got through and needing a little bit more follow-up. We had all of the committee members call in as if they were patients wanting to make an appointment, or if they had a question, or in an emergency situation, just to test our triage system.
We found from talking to them and from having them do call-ins was that calls have not always been returned in a timely manner.
As a result of that, we did increase a couple of our admin rep staffs who answer the phone, but it's still an area that we continue to do quality improvement.
Women that need their annual physical done, they will call the clinics beforehand and ask if they're LGBTQ friendly or accepting, and many times they get a, we don't know what you're talking about. So I decided that I would bring that up to our council, so it's another approach we can take to making sure that all the communities know that it's an inclusive medical facility.
The most important projects basically that we've worked on in our office is advanced directives.
And oftentimes it is found in moments of crisis where patients are at a moment of making important decisions and there has been no conversation. How do we go about making sure that these conversations are had?
We developed a shared decision-making tool that helps prompt those discussions.
Now this has become a capital care initiative. With the advanced directives, we actually are more aware when patients in the office to make sure that they have an advanced directive signed and scanned into their chart.
That's been very rewarding to see the whole process. The patients are really empowered saying, we did this. You know, they were part of each step along the way. When they go into their office and receive that shared decision-making tool and have that conversation, I think it's really a special encounter for them.
In terms of advice I would give for folks that are looking at starting a patient advisory council, the first thing is don't be afraid.
It's important that we're all able to sit down and bring those ideas to the table without fear. Fear that we're being criticized for the care that we're providing or the processes that are in place. Address those and to come up with positive solutions and ideas of how we can make those things better here.
I think the biggest thing that I've learned is to just take everything one day at a time and to listen to everyone. I think in healthcare in general, it's become such a big world to everyone that a patient may get lost. In order to alleviate some of this, you're going to have to partner with the people that you're taking care of as well.
Just, I think, constantly reevaluating how things are going, because it's always changing as far as what's working with the group and what's not.
It's very important to keep the patients engaged, make sure that they're involved in the decision making when we put a new policy. Everything that we've addressed has been per our PFAC members.
You know, I've been doing this long enough to remember the days that medicine was very paternalistic, where we made all the decisions around the patient's care and really didn't engage them in much of a conversation about what that should be like. And what I would tell my colleagues now is we missed a lot of opportunities to have a more satisfying professional relationship with our patients.
It's actually been refreshing for our practitioners to hear what they're doing well and to know that that feedback is coming from patients that they actually treat, who have taken time out of their daily lives to provide us with this feedback and to help us become better at what we do.
Patient and Family Advisory Council is probably one of those tasks that becomes a joy instead of a chore.
When I tell them about that I'm on the health advisory board, my circle of friends, they're like amazed because they don't have that. And they don't have the opportunity to do that. You know, hopefully someday if their, a medical group or whoever they see has one, they'll volunteer.
I just hope the committee goes on. That has become a cornerstone of that practice.
It's a team, and it's amazing you can move mountains with a team.